You ran up on it.
Do you see the room or do you just see my screen? I'm just curious.
Talking to me?
Yeah, like do you see the rest of the room through the owl camera or do you just see me since I'm talking?
I don't for some reason. I just see you and Buddy.
Okay, so that's coming from the owl camera then though, so. I didn't know if sharing my screen up there, which one somebody dialed in would see.
I think when there's are there other people in the room?
There's a couple people in the back.
Yeah.
Oh yeah, but yeah, not around the table. Not around. When they start talking around the table, it'll probably move.
Move, yeah.
Need a few more board members. You guys had a couple house fires out here, Steve?
I had one on Sunday night. Some of the wood burner. They just actually got the wall. It wasn't even the flue. It was the wall caught on fire. That was a good job by our guys. It's just the room that had the wood burner in it and the room above it that's really any damage to. The rest of the house is pretty livable. Talked to them last night. I think today they're going to get their stuff inspected to get their electric turned back on, which this time of year, freezing pipes pretty soon if you don't get your furnace running again.
Yeah.
So you should have that today. And then the one this afternoon was a garage that I think they put out with a bucket of water, if I'm not mistaken. It was relatively small, so.
It was in our territory.
Yeah.
Yeah, I heard this. Don't miss that. I don't miss. I look up, I get all the feeds.
Yeah.
All the departments kind of running.
Yeah.
Oh, man, you know. And,
Yep.
Yeah. There's nothing worse.
Hello.
Bobby was trying to join online. He just texted me. Is it in the invite, Jason? The link?
Hey, Jason, your link, Emily's here. She said that Bobby was going to try and join online. I know that's how I joined right now.
Yeah, it's just in the calendar invite.
Is he out of town too? Do you know him?
What's that?
Is he out of town too?
Oh, actually, yeah, I think it is. It's a good time to be out of town.
I don't have my name underneath, buddy.
What's that?
It looks like a nameplate.
Yeah.
Must be something how I signed on to our camera there.
Of course, yeah, this was off in your seat, you would say.
Over there, but it's not. I'm thinking it's getting it from home, my computer.
Oh.
Having it signed in to Owl camera with my name. I thought I edited that to be.
Ryan Hill, he's, okay. So,
I believe that's him walking through the parking lot.
okay. Cause he's still on.
Yeah.
That's right.
All right,
Hello, Ryan.
see if I can get started one.
Yeah, okay. 5 o'clock on that time, okay. We'll call the, meeting of the St. Joseph County Fire Territory Board meeting to order. First thing, we'll do a roll call of members. Again, I'm Al Kersitz, president of the board. Is Emily Ruffshot?
Here.
Chief Steve Downey,
Here.
Ryan Hill,
Here.
and virtually Jason Critchlow.
I'm here, and I just admitted trustee Bobby.
Okay.
I'm here.
Bobby K's online as well. Too.
Oh, and then Robert Krasinski.
I'm here.
I'm here. Okay, we're here. Okay, first up will be approval of this evening's agenda. Do I have a motion?
I'll motion to approve the agenda.
And do I have a second?
I'll second.
Okay, we have a motion and a second. All in favor, say aye. Aye. All against?
I don't know if you care, Bobby, but all we see is your forehead.
What's
Oh, there, now I see.
no, I'd rather turn the camera off, tell you the truth, chief.
All right.
The motion to approve the agenda passes unanimously. Next up will be the approval of the minutes from the last board meeting. Do I have a motion? Or did you have time to look through them?
I move to approve.
Do we have a motion to approve?
From Jason.
Okay. Do we have a second?
Just reviewing here. I'll make a second.
Okay, we have a motion and a second. All in favor, say aye. Aye. Any against? Say nay.
Sammy, do you want them to sign this?
And again, concerning that last meeting, I apologize for not being here. I had to do a presentation to county council, so that's why I zoomed in, and I appreciate your patience with that. Next up will be public comment. Do we have a public comment from anybody here that would like to know? Nobody wants to make a public comment. It's cold outside. How about virtually? Anybody virtually that needs to make a public comment? Seeing and hearing none, we'll move on next to new business. And I believe that would be you, Chief Downey.
So, I have it down as acceptance of resignation, but one of our guys, Corey Wittinger, is actually going to retire at the end of this month of February. February 24th will be his last day on the books. So it's making you guys aware of it. I don't think there's actually an official acceptance we have to do of the resignation. Can't prevent a guy from resigning, but recognizing that he's going to be resigning and starting retirement. He'll probably, after about a month, continue to work part-time for us, but otherwise he'll be retired from full-time status.
Okay, good for him. Okay. Anything else? No. Okay, we'll move on to old business, state fuel bid.
One of the questions that was asked at our last meeting is if we're part of the state fuel bid. And I wasn't 100% sure at that time, but I verified that we are through the WEX account that we use that has signed up on the state contract for fuel pricing. So just make a note of that.
Very good. Excuse my ignorance. Do we have fuel tanks here?
We have a fuel tank at our station 18, and then we also have a fuel purchase card that we use to get fuel, like usually for Martin's or Speedway. But Martin's right there on Mayflower and Samples, and nice easy one when you come back from the hospital. So
okay, very good. Okay, next up will be the provider unit report.
Yeah, so you guys have, sorry that I was late sending the finance or the budget report to you. That loud TV is like distraction. If there's any questions there, I'm happy to answer them. But outside of the budget there, we don't have a ton to update on our end. Started the year out well. We've got our staff insurance is all set up to go. Yep, nothing too terribly notable. The new budget line items are all divvied out so that we can track part-time and overtime. So you'll be able to see those specific costs now moving forward. I actually think Sammy and Lana, I think there's still some tweaks that can be made on some of these sub items. I noticed it says EMS supplies 1, EMS supplies. I think we need to be more descriptive. I wasn't in the office today, so I didn't get a chance to connect with Lana on, are we tracking each individual station there? Are we tracking ships? What are we tracking there? And so, but I know she was, because of when this meeting falls, here being the 3rd of February, she was really trying to scrambling to get everything in for January so that you guys could see the updated numbers on the budget. So, but that's the only thing, that's the only call out that I have that I'd like to connect with Lana and Sammy on to talk about what it is that we're trying to describe in those line items.
Okay. Any questions on the provider unit report? No? Okay, we'll move on next to the fire chief's report.
So you have our run report there. The first one you have on your activity list. For January, we did 110 runs. We switched from night burst to nearest, which doesn't mean a lot to anybody other than it's a different reporting system that the state now requires. So it doesn't give us the same breakout of type of calls as easy as the other one did, at least not yet. But this gives you overall the number of times that we ran outside of our fire territory, as well as the number of times we received aid. Highlights of the number of what we consider more involved calls, the complex incidents, and then our medic transports. So, any questions on those numbers?
Test.
And then the second one, this highlights the amount of training that we're doing. Always like to focus on that. Our guys are still staying pretty active. 807 hours of training in January alone, so pretty good number, I think. Okay. We have nothing notable to report on our facilities, which is good. And then the other report we have there for you, you see our EMS report. This is a month behind because we get to report usually about the 7th or 8th of the month for the previous month. So this actually shows you the end of December. And page 2 in there, you'll see just how much what our total billings have been, how much we've collected, how much is yet out there that's due to us, another 200,000 that's due to us. So we're engaging now with our EMS billing partner to begin to work down some of the aging that's still out there from the beginning. And hopefully that number will continue to reduce. And we're almost at $100,000 now in the bank of receipts from our EMS billing, which is a good start.
Yeah, that's always important to keep track of. I remember.
Yeah.
When I was with Penn, it was interesting to see. And with South Bend too.
Yeah, well, and you know, I'm curious if the, like, so we've identified 35 runs from the first 3 months that we haven't collected anything on. I just like to know why. You know, is it something that we did as an error on our end, that we didn't provide the right information? Is it something on the other end? Did somebody forget to bill it, whatever? So we're just continuing to work that problem to collect everything we can.
What's TPL?
Where are you looking at?
Net collection percentages, primary payer mix. The last one of those boxes is TPL.
I have to look that one up. I believe it's third party something. I have to think what the L stands for on there. No, I don't know. 100%. I have to look up what TPL, third party,
Yeah.
something. It's where it's not even your insurance, but I forget what the L stands for. I'll find out, you know.
Yeah, just looking at it, Medicare Advantage, 70% collection, MCO is 63. So that's interesting what they're getting from the different groups. And who's actually getting services, right?
And some of it will change over time. Like the patient payer or patient number will always initially be higher because we don't necessarily have their insurance information when we first bill it. So there's like a dip in it where it goes down. Well, then when it's still up there, okay, we still need to collect that money. So that's what we're just trying to zero in as to why. So.
Well, it is interesting that private insurance seems most reluctant to pay.
Yeah.
Okay, any other questions on the annual bill? Seeing and hearing none, we'll move on to other reports.
Jeremy, are you here on behalf of the union or just here because you're on shift?
I could be because of the union.
Okay.
Drafted.
The union has nothing to report to.
Oh, I need to be here on behalf of the union.
That was impressive. Very good. I do have one question myself on that. Within, being virtual last meeting, and I was nominated, I believe, with you, Jason, to be in on the negotiations. When are we going to start that kickoff? Do we wait for a letter from the union or?
February 26th.
February 26th, okay.
I just haven't sent you the invite yet, but we just recently set a date with the union to start it to February. Yeah, I just haven't sent that to you yet.
Okay, that's good to know.
Yeah.
Will you forward him that invite then, Chief?
What's that?
Will you forward that invite to Buddy?
Yes. Yes.
Thank you.
Are there any particular issues right now that need to be?
No,
I
I don't want to miss a meeting.
Yeah, no, there's no issues. We just, last year, we were probably a little bit late on looking at our wages just as a whole and saying, hey, how can we improve things? And was more focused on just getting going. So this year we said, okay, let's start that process sooner. And so we put February to start it, get it going. Go from there. Yeah.
Sooner than.
I think from the perspective of the firefighters, they're hoping to achieve some sort of stability in what they know the future is going to look like from their end. And so I think it's going to be a prolonged conversation, and they're going to need to highlight some priorities for us, the board. And so that's really why we said we should really start that conversation early.
Okay. Very good. Any other reports or any comments? No? If not, we'll move on to other discussion items. Are there any other items to be discussed?
Any events or anything coming up?
No. I had to think if there was something on the, in the summertime, we're going to do a golf outing August 17th, but that's out there a ways. We gotta confirm up a few more dates on that yet, but other than that, we don't have any pressing events. This past Saturday, we worked at the food pantry, but that's really not an event. We just help them out over there.
Yeah, we could do a nice little Easter egg thing out there too.
Usually the IBW does an Easter egg hunt, and we participated with that at their facility.
Thinking of spring things going on.
Yeah.
Good. Yeah, just for a question, refresh my mind, did we go up and assist New Carlisle on the toll road?
Toll road, we did.
Yeah.
Yeah.
What kind of equipment and what kind of?
We sent 2 engines and a medic up there,
Okay,
so,
good.
yeah.
Yeah, that was,
A lot of vehicles, luckily nobody got hurt, and I think, I should say no significant injuries, but, I think in the end, they ended up with 8 or 9 people total that they transported, so.
did our ambulance transport?
I don't think you guys transported, no, I don't think we, the actual transport from it, so. No.
That's good. Okay, thank you. Any other discussion items? Seeing and hearing none, we can move on. Anybody have a recommendation for adjournment?
I'll move to adjourn.
Movement, do we have a second?
I remember Jason saying we actually don't need one once there's a.
Don't start with that, Emily. It's bad territory.
I haven't heard that. I'm used to having a
Motion in a second.
yeah, motion and a second.
It's fine. I told her it's fine.
All in favor
I've got
of
Robert's
adjourning?
Rules of Order right here on my shelf. It's collecting dust.
Of course you do.
We keep it friendly.
I'm on the board of safety. We always take a vote to adjourn.
That's all I'm reading.
Okay, all in favor of adjourning, adjournment? Aye. Against? We are adjourned. Okay, thank you.
Thank you.
All right, guys, have a good one.